It very soon in a bit. The National Hospital Insurance Fund, meanwhile, continues to face criticism over new stringent requirements that will likely lock out millions of poor Kenyans seeking subsidized medical cover. The NHIF, among other changes, has introduced a one-year advance payment system for current contributors. New self-contributors will also pay 6,000 shillings upfront and wait for 90 days before they can benefit from the health cover. The Central Organization of Trade Unions, COTU, now says it will vigorously oppose these changes that it says are punitive to a majority of its members who are low-income earners. NTV's Brenda Wanga starts us off.
Voices of opposition to the National Hospital Insurance Fund's proposal to cap the benefits currently enjoyed by its members are getting louder. The Central Organization of Trade Unions now wants the proposal suspended immediately.
COTU Kenya will not be party to such punitive changes against our members, and we are ready to explore all avenues to stop NHIF from reckless attempts to deny our members the services they deserve.
COTU says the changes, which took effect at the beginning of the year, were not only punitive to low-income earners, who are the majority of the contributors, but were also done without proper consultations with stakeholders, the trade unions included.
We are aware that, and I think members of the press are aware also, that there has been mismanagement of funds at NHIF. And we are aware that investigations are being done. So we don't want anybody at NHIF to try to create confusion so that they cover whatever misdeeds that there are at that board.
Among other things, the changes call for the capping of beneficiaries to just a spouse and 5 children, a longer waiting time of at least 6 months before accessing services for new members, and a waiting period of at least 90 days for defaulters who must also pay a year's subscription upfront. COTU's objections to the changes follow in the direction taken by a cross-section of the population. Legislators now say they will take the battle to the floor of the House.
You cannot say that I, as a person who is married to 2 wives and has 7 kids, that only 1 wife and 5 kids will be discriminated. How do you expect me to be able to cut 4 of my fingers and leave 1? It is not possible.
Universal healthcare is about everybody getting treatment for free. So what NHIF is doing is limiting UHC. That is the problem about Jubilee doing contradictory things.
Sentiments that have already found favor with the National Assembly's Health Committee.
We have already instructed our clerk to write to NHIF and to tell them to suspend those recommendations.
COTU now wants the NHIF board to convene an urgent meeting on Monday to figure a way out of the predicament that the organization says is now threatening the success of the universal health coverage, which is an integral part of the government's Big Four agenda. Brenda Wanga, NTV.